how microneedling works. We're going to talk about who it's for. We're going to talk about who it's not for. We're going to talk about post-procedure care, aftercare for microneedling, different products that you can use that won't irritate your skin. We're going to talk about prepping for microneedling. We're going to talk about everything to do with microneedling. So if you are interested in any of the things that I'm going to be talking about, then continue watching the video. So microneedling, as it sounds, uses tiny needles to puncture your skin, and it creates a physical trauma, which creates a wound healing response, which creates fibroblasts that eventually create collagen, which is why it's called collagen induction therapy. As we age, we lose at least 1% of collagen per year from the age of 35 onward. It depends on who you are. It's different for everybody. And then that increases over time. So we want to be able to keep our collagen, because not only are we going to look beautiful, young, and fresh, we're also going to have strong elastic skin that's resilient and resistant to time, to trauma. It's better to have healthy skin than to have unhealthy skin. As we age, things can happen, and we want to just keep everything maintaining. Now that we have microneedling, which actually comes from a procedure that was first invented in like 1994, 1995, where doctors were using sterile needles to puncture different scars in a pattern, and it created the ability to sort of resurface those wounds. And then in 2006, another doctor made the microneedle roller, which is not what we're talking about very much today. This is something that you can still use at home, but I prefer talking about the microneedle pen because you can have more control over depth penetration, over what the outcome of what your microneedling might be. That's what most professionals use, and if you're watching this video, maybe you are looking to get microneedling done for the first time, or maybe you're looking for a provider who understands these kinds of concepts. You want to ask some questions. So here I am. I'm giving you some information that you can use to ask your provider about, or maybe you can use some of this for your micro roller, derma roller, not micro roller. Microneedle, derma roller, essentially are using the same concepts in creating collagen in your skin. So when the needle penetrates your skin, it causes a trauma response, and these little holes are called microconduits, micropunctures, and within that microneedling may be done with hyaluronic acid that's sterile and medical grade, or you can have a sort of like a meso cocktail introduced into your skin, because microneedling is opening up your epidermis, so then you can use various formulations specifically made for entering the skin, like meso cocktails, mesotherapy type things, to get into your skin to also create extra benefit within your skin. These types of ingredients can be hyaluronic acid, they can be centella, there's PDRN, there's a bunch of different formulations that can change various different things about your skin. But microneedling alone with hyaluronic acid also induces collagen regardless. Like, you don't actually need to have meso cocktails to have a great benefit from microneedling. And there's also a misconception that you need to look like you've gotten a vampire facial in order for collagen induction to happen, or for any sort of treatment outcome to happen, and that's a misconception. You don't need to go super deep to create a rejuvenation response within your skin. So it's okay to have a conservative treatment. It also means that you're going to heal faster, which is a great benefit, especially since most people are into instant gratification. They want to heal fast. They don't want to take months and months to heal. Not saying that it will take months and months, but it does take a little bit longer for a treatment that has been done aggressively than conservatively. There's also less risk of hyperpigmentation or prolonged hyperpigmentation when you're using a conservative treatment. And the conservative treatment is just as good, if not as good, as an aggressive treatment when doing skin rejuvenation. So we want to increase the fibroblast production in our skin with the controlled injury, the microneedle, and then that will create new collagen in our skin eventually over time. So you might have gotten a microneedle treatment and you feel really happy with the results after one treatment, but the real results actually happen probably in 3 to 6 months. You will see improvement over that time, but for the most permanent results, it's always good to wait 3 to 6 months to see where you've gotten with the progress of something like an acne scar, or, you know, reduced fine lines and wrinkles. And within that time frame, it's usually pretty common to have 3 to 6 treatments. And those are usually placed at least 3 to 4 weeks apart. And then after those treatments, you will see the final permanent results in like 3 to 6 months on average. It's important to have a realistic expectation of what you're doing, because these kind of treatments are really beneficial for your skin, but they don't have instantaneous results like Botox and filler, which I have no problem with, but I really enjoy collagen induction therapy and different energy-based devices because they give you a result that is made by your body's natural immune response. And builds collagen, which is really important. And neither of those things build collagen. Things that people want when they're getting their microneedling done. It's good for acne scars. It's good for various types of scars. I've heard that it can be good for stretch marks, although stretch marks is kind of like a ongoing, you know, never-ending, trying to find a treatment kind of thing. I have stretch marks that I've been working with for multiple years, and, you know, I've seen improvement, but you know, they're not going to be gone forever. They're kind of just a part of your body. Actinic keratosis, which is when you get those little bumps on your skin. Skin rejuvenation, fine lines, wrinkles. It's good for an exfoliation process, especially a light microneedling treatment. So, contraindications. Who shouldn't get microneedling? Obviously, consult your healthcare professional for your treatment guidelines. This is just kind of a list of what's a common contraindication for getting microneedling. Nothing I say in this video is healthcare advice. I have a disclaimer in my description, as usual. So hypertrophic scars or keloiding, that's when you get sort of those big raised keloid scars. You usually know if you're hypertrophic or a keloid scar. If you have any history of psoriasis, this can be kind of a contraindication. Any active infections, if you have any sort of like cut or scrape or a big cystic acne in the treatment area, your provider will probably skip that area. So if you have allergies to the metals that are in the needles, if you're a person that gets an allergic response to metals, it's important to double check with what kind of needle your provider is using. If you're using a derma roller at home, like titanium, steel are probably the best ones to use. Anything else is maybe a no-go. If you have any unmanaged healthcare issues, it's a contraindication. You gotta take care of yourself. It's a good idea. Oh yeah, and thank you guys for watching my last video. I really appreciate it. I know there are some people who don't actually do nails who thought the video was really well made and was helpful, and I really appreciate that. I'm glad that I could help you in any way. Definitely have been really reflective on the last few months as I've been closing my business, selling my nail stuff, packing my bags, and starting over. It's definitely an interesting process. A lot has been happening, and you know, I'm just kind of taking it day by day. And yeah. Another contraindication, pregnant or nursing people. This can be contraindicative. You need to consult your medical care provider. So sometimes before a microneedling appointment, if you're working with somebody who possibly you've worked long-term or specializes in microneedling, they may ask you to use a vitamin A and vitamin C serum, you know, up to 1 week prior to your treatment, because these are collagen synthesizers and it'll help prep your skin. This can be really beneficial. And if you have sensitive skin, then you know, you'd want to avoid irritating your skin before your procedure. And for anybody, you know, you need to discontinue all of your actives, aggressive treatments at least 1 week prior to your microneedling appointment. If you get Botox or fillers, you need to wait at least 2 weeks before microneedling so the microneedling doesn't interfere with the interaction of the previous drugs put into your skin. So during a treatment, sorry guys, I love moving my arms so much. This is your entertainment for my sit-down videos. So during the treatment, usually a topical numbing cream is applied for 20 to 30 minutes. It's also important to make sure that you are not allergic to any of the ingredients in numbing cream because it can cause all sorts of different things. It's important to understand the risks of that. I'll let you Google that. And then the area is cleaned with saline and an antiseptic. Alcohol is usually something that's really common to use. I have a microneedling pen to not use on camera, but show you what I'm talking about. My prop. So if I was a person providing this to another person, they would be laying in the bed and I would be stretching their skin and slowly creating circular motions. I just took this tip out of the package, the sterile needle package. It's always important that your provider is using a sterile needle, not dipped in alcohol or soaked in alcohol. I've seen that online where people are like, oh, it's just for me, but it's very important to use sterile products, work in a very clean environment, and alcohol is not sterilization. It's disinfection. And okay, so sterile needle, what I was gonna say is, you know, I used to work in harm reduction before I worked in the beauty industry. And I remember during our training, because we did work with different folks doing different things, and some of those things involved using needles. So part of the process of learning about harm reduction is like seeing like, what does a used needle look like? And what does a needle used after X amount of times look like under a microscope? And essentially, the reason why you want to always use a sterile needle is because when a needle punctures skin, it kind of leaves a little bit of itself within the skin. And I'll include a photo here. A microneedling device, which means there's needles, which means it's always getting damaged each time it's being used. So it's fine for one treatment, but it's not okay to keep using it. Your service provider should have a sharps box. These are provided, at least in my city, is provided through healthcare. Very important. You don't want to be putting needles into the garbage where other people can accidentally injure themselves with, especially people who are, you know, service providers within the trash industry. Kind of so terrible to imagine stabbing the garbage man. So back to the treatment. Sterile needles, thank you for listening. Very important topic. Slowly, the service provider is using their hand in a slow motion, circular with a little bit of overlap, about 20%, and working slowly. From working this way, when the person's on the bed, your hand, the device, is horizontal. So you don't want to use a device like this. You don't want to use it like this, because you're creating tears in the skin and scratches, like a cat scratch, you know? If I were to do this, or if I were to do this, I would be injuring my skin in a way that creates kind of a trauma response, which could cause a scar, could cause bleeding, something that I really wouldn't want. There are various penetration depths within a microneedling treatment. There's various depths for microneedling treatments. Your provider should be following those depths, changing the depth for your forehead where it's very thin, and they can change it where it's thin around your eyes and your jawline, anywhere you have any bony prominence. Your cheeks can have a little bit more depth put into them. And it also varies on the treatment type. Scars, generally, acne scars, scars from, I don't know, previous battles, these all can have a little bit of a deeper penetration depth. But for a conservative treatment, which would be the first treatment that you get from your provider, this can be done under 0.1 millimeter. And why would you want to have a conservative treatment? Of course, I know from hearing from friends and clients that, you know, you want a treatment done effectively right away the first time. But for some people, they may have a different skin tone or a different skin type, one that is a skin type that can have hyperpigmentation, a skin type that can develop post-inflammatory hyperpigmentation, and there's something called PPE, and it's not face mask, it's prolonged persistent erythema, which is redness that lasts for a long time. It's kind of like a redness scar almost. And you don't want that to happen to you, so having a patch test done and understanding that you will still get a good result from a conservative treatment, and that if you need to go deeper in the future with your next treatment, that might be okay. You can adjust the energy of the device and the depth of the needles with the provider. It's really important. It's important, guys, because you don't want to have scars or, you know, be red forever. You just want to induce collagen synthesis. The endpoint of the treatment for the provider is usually them seeing some pinpoint bleeding. It doesn't need to be severe, not like the vampire facial. And it's also, if the skin tone is lighter, some erythema, which usually dissipates between 24 to 48 hours. It can be a little bit longer. It really depends on the person's skin. If your skin is sensitive, if you have sensitive skin, the types, that kind of stuff. That's what changes the outcome of the treatment, is really your body's response to the microneedling. After the treatment, usually the provider will clean the skin, make sure it's prepared with possibly a healing cream. There's various different creams that can help with healing, specifically right after the treatment. A little bit, like a tiny amount of Vaseline, put onto the face. Sometimes the treatment can be treated depending on the reaction with a corticosteroid or an antibacterial ointment just for the first day of when the client leaves. But at home, it's important just to use very mild face washes, no fragrance, keep out of the sun, use mineral sunscreen. It's very important to not use chemical sunscreens after a microneedling procedure. Make sure that when you are at home and you've washed your face, you're kind of patting as opposed to scrubbing. You don't want to cause extra irritation, which can cause prolonged erythema or excessive irritation. You don't want to prolong the healing period. When you're going outside, to use your mineral sunscreen. I know that they have way more elegant formulations than what I've used during my clinic, but any sunscreen that's mineral, if it makes you look like a ghost, better than not going outside without any sunscreen. You want to avoid doing heavy workouts right after your treatment, maybe for the first 48 to 72 hours. You want to make sure that you're not going to the pool or sauna. Any activity that would induce extra redness within your skin, this should be stopped at least for 2 to 3 days. There's different patterns in microneedling sometimes. Sometimes there's a crosshatch pattern. And then the circular one that I told you about. While you're stretching the skin, while they're stretching the skin, stamping techniques. Microneedling can also be used to stimulate hair growth. This is a really interesting topic. There's things like minoxidil and ginkgo biloba and different stimulating actives that can help with hair growth. And essentially you can use a stamp microneedler, and you can also use a microneedling pen to help stimulate hair growth. As I said before, you want to be patient with your results. If you feel like it didn't work because in 1 month you feel your skin looks the same, but it's your first treatment, I would say continue waiting. Also, get more than one treatment. It's not a one and done deal. It's not like going to get Botox. You got to go a few times, but it's worth it. And the more you're persistent with it, the better the outcome. Providers will do 1 to 3 passes for a conservative treatment, and then they vary the depth depending on what area they're on in the skin. For different scars, it could be 3+. It could be 3+ passes. Really depends on the scar, where it is, stuff like that. Something interesting that I thought was that the speed of the pen actually increases the production of fibroblasts, but the faster the speed of the pen is working, the more likely the client is able to, or the more likely the client is going to be more red. Does that make sense? Yeah. So if you have sensitive skin, faster doesn't always mean better. So for something like post-inflammatory hyperpigmentation, you definitely want to treat your skin at least 1 month prior with azelaic acid. I know you can go to The Ordinary and get a 10% formulation. You can also get 15% prescribed. And this is for folks who possibly have darker skin tones or just get post-inflammatory hyperpigmentation pretty easy. I usually do. So use that 3 to 4 weeks before and then discontinue 1 week before your treatment. And that can help with lessening the chance of getting post-inflammatory hyperpigmentation. And then before your next treatment, or let's say 3 or 4 days after your treatment. Azelaic acid can also be used before your next treatment, but you want to make sure your skin is recovering okay, and you know, probably 4 or 5 days after your previous treatment, start the azelaic acid and then discontinue a week before your next treatment. Azelaic acid is a really good anti-inflammatory, and it's also really good at reducing redness and hyperpigmentation. I really like azelaic acid. Okay, so a slip layer. What is used for the slip layer? I did talk a little bit earlier about that, but also hyaluronic acid that is medical grade is the best for your skin, not just because it's like medical grade. It is made in a lab, and there are standards of sterility within, you know, the cosmetic production of that hyaluronic acid, as opposed to cosmetic formulations, which have their own standards of production, which are good, but there are still, you know, more of a chance of contamination within the products as opposed to something in a lab. Like, either you could have contamination, but you know, the better choice is the medical grade hyaluronic acid, not cross-linked filler, not like the stuff you put in your face for volume, but the stuff that's made specifically for mesotherapy. It's really important, if you're using a derma roller at home, that you're using, you know, a disinfected area, a very clean area. You don't want to be multitasking like on your computer and doom rolling at the same time, just because there is a chance that you can get granulomas, you can get allergic reactions. Essentially, your skin may find something within what you're using, or what you're using either to needle with or as your slip layer, and it'll pocket it away, and you'll get like little bumps on your skin that are kind of like a permanent rash, and it's not cute. So make sure that you're working in as clean environment as possible, that this is your treatment time when you're derma rolling, that you research ingredients and understand that you don't want to microneedle in regular cosmetics. You don't want to microneedle in your tretinoin. You don't want to microneedle in your vitamin C serum. You don't want to derma roller in any of those things that are for the topical treatment of your skin, because there are different grades of cosmetics, there are different standards in formulation of these things. That's also why the cost can increase when you're buying something that is for specifically mesotherapy, for derma rolling, because it's made in a completely different manner than your regular day-to-day cosmetics. And I know this because I've made a lot of cosmetics, and I have a very high standard of making cosmetics. You know, I take that kind of stuff very seriously, and I know other people do too, but I also know that I would never use any topical creams and ointments that are designed for the top layer of my skin to microneedle or derma roll. So make sure that you are finding mesotherapy grade products for your derma roller if you're at home. If you use a derma roller, look for titanium steel. I think it's titanium steel. Look for the ones that are very high quality steel, because those aren't going to degrade as quickly as something that has, you know, something that's lower quality. And those ones you do have to disinfect, so keep them clean, keep them away from, you know, finger contact and all sorts of other stuff that can happen. Don't give it to your cat or dog to play with. You should use an ice pack at home. Sometimes the provider will use an ice pack after the treatment, because this helps bring the internal heat from the injuries to the surface, and that will help reduce the risk of hyperpigmentation, of prolonged erythema. It makes you feel better, you know, because it does feel like, yeah, so after the treatment, it's totally normal to feel like you got sunburnt, to be dry, to be itchy, to want to scratch, but definitely don't do any of those things. You can use a clean ice pack, put it in a paper towel or a clean towel. The microchannels are usually healed up after, you know, a few hours of the treatment, but keep hygienic, and that can help with feeling better when you have a sunburn. So it also helps when you are taking care of your skin.